Thank you. Um, as everybody knows, COVID-19 has took the world by surprise. It's taken also our organizations, our physicians. Um, we talk about pandemics, but we never actually went through them or were there. So it was a very big shock for everyone. And the first thing, as an organization and individual physicians, we learned that physicians were in a very unique position. They were at the front lines. They were the ones who were expected to obviously treat the COVID patients. They also were expected at some periods, especially because it's taken a long time, to also provide for the regular health care of the population. When you look at the healthcare systems, the whole COVID-19 highlighted its strengths and weaknesses. And I think one of the strengths that we've all learned is the human factor and the healthcare workers. And because we know how important they are, I think the first lesson that we should all learn from it is that we need to invest a lot in our healthcare workers, in the professionals. We need them because without them, we won't be able to combat anything in the future. That is the first thing. At the beginning, I think that they were a little bit sidelined, and they didn't take enough part, not as an organization and not as individual, with the decisions, or at least that wasn't the feeling. They didn't feel that they got enough information. They didn't feel that they knew exactly what was happening. And even when we're talking, for instance, about personal protective equipment, it wasn't at the beginning completely, um, didn't make people feel safe enough. So I think that the most important lesson that I would like to say at the beginning is that we need to invest in the healthcare workforce. We need to make the physicians feel safe. We need to give them information, and we need to encourage them to take a role that they did take as bringing forth messages to the public. We know that a lot of the public would look up to the physicians, whether it was their personal physician or the physicians' organizations, to try to get information about COVID-19. Now, obviously, it's very difficult because the information has been a learning curve, and people are, and we're all learning as it's happening, and things are evolving and changing. But if the physicians feel in a good position that they are getting the information is transparent, that it trickles down, I think it's easier for them to take part in it. For instance, in the issue of vaccination, which is so important, and we want to get the public to get them to be vaccinated. We know that this is a very important role for physicians to explain, to engage with them. But also, if we want the public to accept personal restrictions, to accept the idea of taking precautions, using masks and social distancing and so on, once again, we need the physicians. So I think that the message that we need for the future is that we need to invest a lot in the healthcare force. One more thing that I want to say is we also have to invest into the healthcare systems. We cannot wait for a pandemic and then just decide that we are investing. And we know that many countries around Europe and possibly around the world at that point actually put in a lot of money into the healthcare system. But we need to be prepared before. We need to be in a situation where we will have enough hospital beds, where we will have enough physicians in the ambulatory setting, where we will have enough facilities to answer for the geriatrics needs and so on. And if we do that on an ongoing basis, then hopefully when the next crisis, I don't know if it'll be a pandemic or anything else, we will be better equipped for it. So I think that there is work to be done. Would like to just point out one positive lesson, and that is the collaboration. I think we would have never been able to overcome it without collaboration between all the stakeholders and all the players within the regional and within the international setting. We would never be able to get a vaccine or several vaccines within a year if it wouldn't have been a multi-central collaboration. We would never know how to treat our patients if we wouldn't be able to call our colleagues in other countries and learn from them what to do and what not to do. And if we are at the race for maybe finding medication, again, we need collaboration. So I think a collaboration between governments, between NGOs, between physicians and other healthcare workers, and between the public, I think that could be the best solution we could have.